Cartesian stands for COVID-19 effect on arterial stiffness and vascular aging.
COVID-19 is an endothelial disease. So the virus harbors on the endothelium, infects the whole body, and will target acute complications on artery side with thrombosis, myocardial infarction, heart failure, pulmonary embolism, that will lead to the grave severity of the disease during its acute phase.
Starting to discover that COVID-19 induces also persistent symptoms and prolonged illness. And this involves also the cardiac system. Inflammation will then induce cardiac fibrosis. So we hypothesized that the same mechanism will occur in the arteries too. Inflammation is favoring accelerated vascular aging.
The aim of the Cartesian study is to evaluate the presence of EVA following COVID-19 infection in patients with COVID infection of different severity and by comparison to patients who are free of COVID infection.
The Cartesian study is a prospective multicentre study. Patients will undergo 2 visits, one 6 months and one 12 months after COVID infection, and they will undergo different tests measuring vascular function and structure.
We will use up-to-date techniques to evaluate arterial stiffness, carotid femoral pulse velocity, carotid stiffness, but also central hemodynamics, flow-mediated dilation, radial carotid and radial structure and function, and cardiac ultrasound. Population will be followed then for 2 years, 5 years, and 10 years with a collection of cardiovascular events and mortality.
The Cartesian study was initiated in France, in our centers, but indeed it's a federation of several national studies, with a shared protocol and with centralized data collection. The Cartesian study involves 48 centers from 24 countries. 4 of them already started recruitment and the others are on the way.
And with that, I thank everybody of you who is participating, the persons who will be participating in the future. I warmly thank the Artery Society for supporting the startup of this study, but also the VasAgeNet consortium, which is helping a lot, and all the industrial partners which have adhered to the protocol and will help a lot in the future.